All right. All right, well, welcome everyone to the September 28th edition of the COVID Community Update, COVID and other topics. So just to start, as usual, with the COVID statistics, look at our map in New Mexico. These are our community levels, and we are all green for the first time in maybe ever since they started making this map, I'm not sure. And that is really a good sign that levels of COVID are coming down. And I'll just say a couple caveats. I mean, this also does take into account hospitalization, so good that they've come down as well. And then, you know, again, we always have to kind of keep in our mind that COVID hasn't gone away just because the map is green. This map really shows just the number of positive COVID tests, really. So you can see that COVID is still around, but just the levels are coming down. So not as many people are hospitalized. It's not having as big an impact on our communities. And that's why the other map is green. But we're headed in the right direction. And then also in the back of our minds, we always have to remember just like, you know, what could come next and not get too complacent. I know, I think since the last time we met, maybe President Biden did mention that the pandemic is over. And I think, you know, that got a lot of flack because we know COVID isn't over. I think the way we respond to it definitely has changed over time. Okay, so this is the New Mexico specific like cases by week. So you can see that we're continuing on the downward trend here at the far right of the graph. And then variants, which are kind of that like the factor that we just, you know, you never know what's going to happen with the variants. For right now, BA.5 is still the majority variant really across the US and definitely in region 6, we're at about 88% of the people who have COVID have BA.5. And what's creeping in there are a couple of other newish variants like BA.4.6 and BF7. They're a tiny percentage, but you know, we do just have to keep an eye on them and see where it goes. So this map is nice. They update it every week and we can kind of see, you know, in 2 weeks time, we'll see what it looks like. The good news about BA.5 still being the most common variant is it does match very nicely with the Omicron booster. So that's one good thing. Okay, so we did get some questions last time about chronic conditions. And so we're going to take a little break from COVID and come back to it in a few slides. But just looking at chronic diseases in New Mexico, and I think it is, you know, we have had a lot of focus on COVID over the last 2.5 years. We've had to, it's been a major public health threat. But in the background are these other public health threats and personal health threats that really haven't gone away and maybe haven't gotten as much attention as they need. And so the big ones in New Mexico, and we're not alone in this, is heart disease, cancer, chronic lower respiratory diseases, so diseases that affect the lungs, diabetes, chronic liver disease, and then Alzheimer's disease or other causes of dementia. So, you know, the connection with COVID here is that what we've learned over the last 2 years is that people with chronic conditions are more likely to get very sick from COVID. And a person's risk of severe illness from COVID definitely increases as the number of underlying medical conditions increases. And on the CDC website, you can actually see the diseases they think put you at risk for COVID and kind of the studies that have been done to back up those claims. So high blood pressure is one that you just, I mean, it is called the silent killer because oftentimes people have no symptoms of high blood pressure. It's a pain to take pills every day when you don't feel bad in the first place. And it also is kind of hard to put together with how like you would get a worse case of COVID just because you had high blood pressure. But it is on the list. There have been studies that have shown that people with high blood pressure do have worse outcomes from COVID. And one study suggested that people with high blood pressure may be more than 2.5 times more likely to be hospitalized from COVID. So it is something to be taken seriously. Now, one of the things about high blood pressure, I will say, having been in medicine a fairly long time, is like that target for a normal blood pressure, what is it exactly? It seems like it's changed over the years, and it has changed over the years. And that's partly because studies have been ongoing about the impact of high blood pressure. So I feel like it's sometimes easy when it feels confusing to just ignore it. But what I like about this is the American Heart Association and a lot of other organizations that have come together to develop criteria for blood pressure. This is the latest way of looking at it. And it's really not that different from some of the other tables we've seen over the years. But what is kind of interesting about this does push the definition of normal lower than it has been, let's say, 5-10 years ago. So normal is really having that systolic blood pressure, the upper number, less than 120, and the diastolic, or the lower number, less than 80. So, you want your blood pressure to be 120 over 80 or less. And then you can read kind of the next category is elevated blood pressure. Most people would not suggest, most clinicians would not suggest medication for an elevated blood pressure, but would start to talk with you a little bit about like, okay, salt, exercise, and diet changes that may help lower blood pressure. And then where you get into discussions potentially about treating high blood pressure is when you get to that stage 1 blood pressure with a systolic of 130 over 139. And again, even there, a lot of clinicians would give it some time for a kind of lifestyle modification. Then when you get to 140 or higher, most clinicians are, should be suggesting medications. And then hypertensive crisis is really a dangerous blood pressure in the moment if you're above 180 over 120. And then you might need some hospital care or kind of immediate medication. Some outpatient docs will actually give meds in the office. So the other complicated thing about blood pressure is it goes up and down all the time. And so one of the things that's kind of crept into the recommendations is the idea of home blood pressure monitoring. Some people get nervous at the doctor. Some people have you've just run into the doctor's office, they put you in the chair, they slap the cuff on, and they take your blood pressure, and you have hardly had a moment to calm down. And then your blood pressure might read high. And you think, is that because I have high blood pressure or because I was kind of stressed in the moment? So you definitely, and we can talk more about this, but good blood pressure taking technique where you really let your patient sit, they don't cross their legs, they don't have their arms waving around, they're not talking, that'll give you the best blood pressure read. And then having patients where they're in those borderline categories, work on trying to do home blood pressure monitoring is really helpful so that you have a picture over a number of days, different circumstances, what their blood pressure is reading, because it is a hard, you feel like you could be chasing numbers up and down. Okay, so back to the COVID and preventing COVID. Stay up to date with your COVID-19 vaccine. So right now, that means getting the Omicron booster if you're 2 months from your last shot. Get tested if you have symptoms. Seek treatment right away if you have COVID-19. And this is, again, really targeted at that group of people who have underlying medical conditions. And avoid contact with people who have suspected or confirmed COVID-19. We know that everyone's being a little bit looser, at 5 days. The CDC recommendations are to stay in isolation for 5 days if you have COVID, and then you're allowed to wear a mask and, go back to work. But if you're someone with a lot of underlying medical conditions, you might want to be a little bit careful about like not having lunch with that person, and then wearing a mask. Okay, so the Omicron booster, I think just as a little bit of a look into the future, Omicron boosters for kids, so that's really 5 to 11 years old, are on their way. So Moderna asked for FDA approval for the Omicron booster for kids 6 and older, and Pfizer is asking for approval for ages 5 and older. And that matches up with the approvals they have for their kids vaccine. So Pfizer, the kids vaccine for Pfizer is 5 to 11, and the Moderna vaccine is 6 to 11. Okay, and so that question of like, why do we really need boosters? Why didn't the first set of shots just, why aren't they good enough? So the Omicron booster will help restore protection that is decreased since last vaccination. And almost all vaccines, when you give them, like over time, immunity wanes. Some vaccines and some illnesses really provide pretty long-lasting immunity. So something like chickenpox, like basically we all learned if you got chickenpox as a kid, you have lifelong immunity. And even that isn't totally true for absolutely everyone. Sometimes you do see second cases of chickenpox, but it's very rare. But then like the common cold, there's another virus. If you get the common cold, it gives you protection for maybe a month, and then you can get another one, or certainly the next year when the cold comes around again, you're gonna get it. So anyway, the way our bodies respond to different viruses is different. So the Omicron booster, so what we've learned about COVID is, you are protected after you get a case of COVID or after a vaccine, but that immunity does wane. The antibodies just kind of go away. So this booster is gonna basically get your antibodies revved back up, and those antibodies are gonna be more targeted at Omicron variants, specifically BA4 and BA5. So going into the winter, where there's still, again, no one knows, but there is talk about another surge of cases. Again, a lot of people come inside, and that's probably one of the biggest reasons. So anyway, getting protected now as we look at the holidays and a lot of gatherings and a lot of indoor time. Okay, when to get the booster? You really can get the booster as soon as you're eligible, and everyone 12 and over can get the Omicron booster now. In the coming weeks, it probably will be 2 or 3 weeks, then kids 5 to 11 will also be able to get the booster, assuming it gets approved, which I think at this point, we're pretty sure that'll happen. So again, just reviewing who can get the Omicron booster, it's kind of basically everyone. So if you've had just your primary series, so let's say 2 shots of Pfizer or 2 shots of Moderna, and it's been at least 2 months, then you can go on and get the Omicron booster. If you got those 2 shots as the primary series, and then you got the booster last October when it was first approved, or anytime since then, and it's been at least 2 months, you can also get the Omicron booster. And if you're one of the people 50 and over who were recommended, or immune compromised, who were recommended to get their primary series, and then a second booster was approved for you in March of this year, and it's been 2 months since you got that second booster, you can still get the Omicron booster. And then if you were someone who's immune compromised, so your primary series was 3 shots, and then you went and got your 2 boosters, and it's been at least 2 months, you can still get the Omicron booster. That will be dose 6 for you. And then we'll hope that we don't have to get quite as many going forward. The ideal would be we get 1 a year like flu and we're good to go. But I think no one's sure that we're there yet. Okay, there is an Omicron booster toolkit available now. Liesl has the link in the slides. It's got posters, postcards, social media posts, and you've probably seen, at least I think this one was in the paper this weekend. The campaign is It's Time NM. It's time for your Omicron booster, New Mexico. And okay, and then last time we had a lot of questions about NMSIS. And hopefully, I know we talked about it a lot last time, but for anyone who doesn't know what NMSIS stands for, it's the New Mexico statewide immunization information system. So it's basically a database that holds all the immunizations given in New Mexico, but providers do have to report those vaccines into this database. So it's been, for COVID, it's required for providers to report, but it has not been required for like childhood immunizations to necessarily report. So you don't, unfortunately, it's not 100%. The general public can access their vaccine records through VaxView, and that's the public-facing side of NMSIS. So if you as a CHW or other people on the call who work in healthcare, you can have a read-only access to NMSIS. So at least you can look up patients who are asking you like, why can't I find my record? You do have to take these 2 trainings, and then you'll get a certificate at the end, and you send it to that email address, our NMSIS team, and they can set you up for read-only access. All right, moving on to a quick update for monkeypox. There have been 25,000, more than 25,000 reported cases of monkeypox in the United States. In New Mexico, I think we are up to 42 or 43 as of yesterday. And again, in New Mexico, it's been kind of a steady, I don't know, 3 to 6 cases a week. We haven't seen any kind of crazy spread. On our website, our New Mexico DOH monkeypox webpage, they are starting to post some of the weekly New Mexico specific data. And this is what it looks like. So basically, most of our cases are in Bernalillo or Santa Fe. This does tend to be something that affects urban areas more. The age of people in New Mexico who have gotten monkeypox tend to be between 20 and 40, the majority. It's been, some of this information is suppressed for the general public because they don't want people to be able to kind of pick out individuals. But for this medical crowd, our cases have been all men. So monkeypox in kids, it is possible for kids to get monkeypox, and in Africa, not that uncommon. In New Mexico, we've had no children under 18 have monkeypox. And if you look across the United States, so this is on the CDC webpage, their data about ages, there have been about, I think it's about 60 kids, 16 and under who have gotten, or sorry, 35 kids 16 and under who have gotten monkeypox. So it's still very uncommon compared to the 25,000 cases that there are. So the rash is the most common symptom of monkeypox in kids, and the risk to kids is very low. And can children get vaccinated for monkeypox? They can. It's not actually a recommendation at this time unless they've been exposed. So let's say a parent gets monkeypox and they've spent time in close contact with their kid, then it would be an option for that kid to get vaccinated as kind of a prevention move. But the vaccine is it's approved from 18 and up, and then there was an EUA like we have for COVID that said it's okay for kids 18 and younger to get vaccinated. All right, and that's all we have. Thank you for all that you do. Here's a beautiful fall picture. We were just talking at the beginning about how it does feel like fall's in the air these mornings. Balloons and cool temperatures here in Albuquerque. So thank you so much.
When taking blood pressure, shouldn't it be taken in both arms? Also, I am constantly having to remind MA to use the right size cuff for arm. And also, are lower wrist cuffs okay to monitor blood pressure at home?
All good questions. So on the wrist cuff and finger cuffs, the American Heart Association does say they are less reliable. So I think there it's a little bit of a judgment call. If you really have, not a big worry about having blood pressure, you're not borderline blood pressure, it's probably fine to start with a wrist cuff. They're certainly more comfortable than having that cuff around the upper arm. But if you have the choice and you can get a cuff around the arm, that really is the better way to go. I know my dentist has like a little wrist cuff that they use, and for that kind of setting, that's probably okay. He's not going to treat my blood pressure. He's just trying to get a ballpark to make sure it's safe to do dental care. For the question about take it in both arms. So that's a little bit of an individual. So first of all, I want to say, like, your own organizations that you work for probably have guidelines about how they want you to take blood pressures, and that would be the first place to go in terms of recommendations. The both arms thing is looking for a specific condition called coarctation of the aorta, where you will get different side blood pressures on different sides. So for just a general screening, in patients that you're not worried about that in, just one side is okay. I've definitely had patients that say, like, it's always better in this arm than that arm, and the difference is minimal, then you can, I've definitely taken it in both arms for patients that are just curious, or they just really believe that I took it in the wrong arm. But overall, my opinion is it wouldn't have to be something you have to do every time in every patient in a medical setting. There was one other part of that question and I'm forgetting. Scrolling down here to see what part I forgot. Oh, the right size cuff. That is an excellent point, because definitely a too big or a too small cuff will give you, too big gives you too low a blood pressure, and too small gives you too high a blood pressure. So that's why there's lines on those blood pressure cuffs. It'll kind of guide you on how much overlap, and you do want to use a right size cuff. Thank you for those points. And again, that on the American Heart Association website, there are those good rules for whether you're taking it on yourself at home or in the office, but sitting, feet flat on the floor, arms at rest, not talking, not needing to pee. If you have to pee really badly, it can raise your blood pressure by like 5 to 10 points. Not having had a ton of caffeine before you come in. Yeah, those are kind of some of the guidelines. No math right before you come in, just kidding.
Next question is it true that you can mix COVID vaccines if the one you've previously received is not available?
So for this question, I'm going to divide it into the primary series and the booster. The booster one is easy. You can definitely mix and match whether it's available or not. Like, you can decide, I've gotten only Pfizer, I'm going to try Moderna this time, and vice versa. And the only exception to that is for kids 12 to 17. They can only get Pfizer right now because that's the only approved Omicron booster. Now, going back to the primary series, CDC still says, try not to mix your primary series. My guess is that will change one of these days, but for now, they do say if you start with Pfizer, finish with Pfizer. If you start with Moderna, finish with Moderna. But if you live in a place where you just can't get that other COVID vaccine, it is okay to mix and match the primary series. So that's sometimes rural areas, or sometimes there are, like, we've had homebound patients where, they don't, actually that's probably a bad example because we bring both when we do homebound patients, but you can imagine a situation where it's just really hard for a patient to get the same brand, and you're not going to do harm, and it's probably going to just be fine to go ahead and give them the other brand. but the official word is for primary series, don't mix and match.
Thank you. Next question. Why 2 months after the last shot to get the new shot? So I think the Omicron booster, you wait 2 months since your last shot, when it used to be 5 months for the other booster.
Right. This is a very good question. And I think a lot of people do feel like the ideal time between shots is somewhere between 3 and 6 months. I think the reason they picked 2 is to kind of encourage people to get this Omicron booster before the winter, holidays. Traditionally, like it was sort of last Thanksgiving that we learned about Omicron for the first time. And then you go into the Christmas holidays and there's a lot of, family gatherings. So, and then the other reality is almost everyone is more than 2 months from their shot. So if you're someone under 50, you were eligible for a booster last September, a year ago, and there's been no other booster recommendation. So most people, even though they're saying 2 months, most people are more like 3, 4, 5, 6, 7, up to 12 months away from their last shot. So I think that's partly why they decided to just pick like a nice, even, easy to remember number across the board, if that makes sense. But to your point, if you are someone who kind of dragged your heels and just got that booster, 2 months ago, you could probably wait till you're more like 3 or 4 months out from that last shot and be just fine. And you will see experts in the news recommending that.
Thank you. Maritza, do you want to go?
Yeah. Hi, everyone. So I had a question and I wanted to confirm with Dr. Miranda. So what about those people that got their primary series a year ago and then now they wanting to get either a booster or their second dose, but it's been a year ago that they got their first vaccine? What are we doing about that? Do we just give them that second dose or do we restart them?
So you're saying they got only one dose a
One
year
dose,
ago? Okay.
yes.
Yeah, so fortunately, there's no need to restart. So they're gonna, if they got that first Pfizer a year ago, and they're just showing up now, unfortunately, I mean, some people are coming saying, oh, I want that Omicron booster. Unfortunately for them, they have to finish that primary series. So they're gonna get the regular old Pfizer for that second dose. And then in 2 months, they can come back and get the Omicron booster. Or to Ife's point, maybe 3 months or 4 months. But yes, no need to restart. That one dose is still good.
Great, thank you.
Another question is there any research on how long protection from the Omicron booster will last?
No research yet. And partly that is because it just started being given in the US and even in Europe, where they started ahead of us with the BA1 and BA1 bivalent, it hasn't been that long. So yeah, so we don't know. And at the beginning of talking about the Omicron booster, there was a lot of talk about how maybe this one would last longer. And I haven't heard too much about that. So I don't think that anyone's that hopeful that it will last a lot longer. I think people are hopeful that maybe there'll be more time between surges. And so that would sort of be the reason we could go to a yearly vaccine. And I know that they're working on longer lasting vaccines. So we'll see, maybe we'll be happily surprised.
There's a question kind of posed to everyone, but maybe Miranda would know. It says, does anyone know if free COVID testing is going to continue after November? Do we know how long the Project Act is lasting? Or?
So Project Act, where you can order tests, will go through February of 2023 or until we're out, we kind of purchased a certain amount of tests, but the program itself will go through February of 2023. And right now it looks like we're kind of on track to have enough tests to get us through that time. And let me get back to you about kind of the plans for curative, because I think they are going to try to do some kind of contract where there'll be some free testing available for people who are uninsured. But yeah, I mean, it does look like the public health emergency will probably end in December, and then we are going to have some of these changes where it's very possible that testing is less accessible, except for the home tests.
Does anyone else have any more questions or comments that they want to raise? You can put them in.
Yes, I do.
Oh yeah,
Okay,
go
so,
on. Phil.
so during our QI session, a lot of time our CSWs have been asking, it's really hard to find the record of the vaccinated people through VaxView NM. So the trainings that was in the slide, if we could maybe just like elaborate a little bit more on that, I think it would be helpful for everybody, because a lot of time they don't know what vaccine they got in the past, and it's hard to get the record from the VaxView NM. So
Yeah, so the training is going to be on the provider side of NMSIS, not the VaxView side. And I think someone on this call 2 weeks ago mentioned that the search function is better on the provider side. So you can put in not the whole first name or not the whole last name in case someone spelled their name. It's not usually them who spelled it wrong, but the person at the vaccine site. And then you can, and a date of birth. And then you can more easily see, oh yeah, this is like Mary Elizabeth spelled with a Z versus an S or something like you can kind of see what the mistake was. So I think that would be the advantage of being able to access NMSIS on that side. VaxView, partly because it is public facing and they definitely don't want you being able to like accidentally see someone else's record. It's super, super fussy about the name you put in, the cell phone. I think I told you guys that when I went and got one of my COVID shots, they had my home phone on record. And so they used that. And then my record wouldn't match up because the other two I'd given my cell phone. But I did reach out to the NMSIS help desk and said, like, I don't know why I can't find my record. And they basically merged them and now I'm good again. And now I know to always give my cell phone and not my home phone.
okay, thank you, Dr. Miranda. Last question is, so anybody can take the training on the provider side and then they can view or like search it from there?
Mhm.
Okay, awesome. Thank you.
And I don't think it's not that bad of a training. It's been a while since I've done it, but.
Hi, everyone. Dr. Miranda, I have a specific question regarding someone that I'm dealing with right now. They're in college and they have, I think they've had 2 shots, but they haven't had any of the boosters. But are you saying, for clarification, that they would have to then start getting their boosters before they could get the bivariant, the new shot? And then the other question that goes with that is, the professor actually told them to come to class, which I thought that we still had to maintain at least 3 days or 5 days once you have an active diagnosis or COVID virus in your system and have tested positive. So what is going on?
Right. Okay, on the vaccine, just to clear that up, the minimum like qualification for the Omicron booster is just those 2 first shots, or 1 if you got Johnson & Johnson. So it's only, I think the question before was, what if you'd only had 1 shot of Pfizer? Then you have to get the 2nd shot and then get the Omicron booster. But if you are someone who got that primary series, which I think in college, a lot of people got the primary series and skipped the boosters because they're like, I don't need a booster. But now it's been like a year and a half since they've been vaccinated. They can go straight to the Omicron. Does that make sense? So you don't
Yes,
have,
ma'am. That makes
okay,
sense.
you don't have to, you get the pass on any of the past boosters. If you've missed any of the other boosters, no worries. But they are insisting on that primary series being in place.
Okay, and then what about the time that they're supposed to be in isolation or after being diagnosed
And
positive?
you are absolutely right about that. So lots of things relaxed, but a minimum of 5 days of isolation if you test positive for COVID has not relaxed. So if you test positive for COVID, it's 5 days from the beginning of your symptoms. So if you waited 2 days, sniffly, coughy, sore throat, and then got tested and it was positive, you can go back to the beginning of symptoms, count 5 days, and on the 6th day, you can go back into the world as long as you wear a mask for another 5 days, don't have a fever and haven't had a fever for 24 hours, and are overall feeling better. So if you still feel really crappy, just stay home, continue to stay home. Now, the couple exceptions to that are all exceptions that mean you should stay home longer. Like if you've been in the hospital, then you really should stay in isolation 10 days, not 5 days. People with severe immune compromise should stay home at least 10 days and not 5 days. So there's no exception where you get out of isolation faster, except this little part of the CDC where they say you can test out of isolation sooner. And that is you have to have 2 negative tests 48 hours apart. So pretty much you're at 5 days. Like it's still really hard to get out at 5 days, period. So that professor is not correct.
No, and she's penalizing this person. So is there any written update that we could get for situations like this? Because it's very difficult and people are obviously confused, or maybe the professor just doesn't care. I don't know. But I know it's not an isolated case because I've heard of things like this before with jobs and at work and people wanting them to come back sooner and they haven't tested negative, etc.
Yeah, I mean, we probably do have something. I actually did just see a like a nice flow chart, and Liesl, maybe I will share it with you and see if we can just tweak it a little bit. But it's one that I think they send if someone tests positive and the case investigators call. I think they send this out as a nice flow chart of when you can get out of isolation. So that would be a simple graphic, referring people to the CDC. But for that student, I would probably do something like go to the dean of students or the health centers, because the dean of student, like those people who've been dealing with COVID for 2 years really should know the right regulations. I think the confusion came that if you were a contact to COVID, you used to have to quarantine, and they really have gotten rid of that. They basically say wear a mask as long as you don't have symptoms, test on day 5, and otherwise, you don't have to stay home unless you develop symptoms. And so I think people kind of mix those two up in their mind. And maybe that's what happened with the professor. But we'll try and get you some stuff. And again, I would send that kid maybe higher up the chain at college, just because it sounds like everyone could use a refresher.
Thank you very much, Doctor.
Thank you for raising that. One more question that I see in the chat is there any research on COVID vaccines regarding if there will be a 6-month or yearly vaccine like the flu?
We definitely don't know the answer yet, but I think, I think Fauci at the beginning, Dr. Fauci at the beginning of Omicron said, yep, this is the start of the yearly COVID shot. And certainly people are hopeful for that. But we'll see. And it may be the kind of situation where for most people, it's a yearly vaccine like flu, but maybe if you're immune compromised, you do have to get the 6-month, might be something like that. But I'm really just making that up at this point. We don't know. Yeah, and we probably will know more about the Omicron booster for kids 5 to 11 in 2 weeks' time. So stay tuned. All righty. Well, thanks as always for joining. I always love being on this call and love all the questions. Thanks for all you do for your communities. I'm going to hop off to my next thing, but I'll see y'all in 2 weeks.
Thank
Bye.
you.